I am Dr. M. Muhammad Maharub Raja, Assistant Professor, PG and Research Department of Microbiology, Jamal Muhammad College, Tiruchirappalli. I am going to discuss Mycobacterium leprae. It is a causative agent of leprosy. So, leprosy is an infectious disease derived from the Greek word lepros, which means scaly, referring to the scales that form on the skin. It's a disfiguring skin sores. It causes nerve damage and progressive debilitations. It is otherwise called as Hansen disease. In 1873, G. A. Hansen identified the first Mycobacterium of leprae as causing disease in man. Mycobacterium leprae is rod-shaped acid-fast bacilli. It cannot be grown in bacteriological media or cell cultures. It grows slowly and present intra and extracellularly, forming the characteristics of clumps called globi. It's mainly affect the skin, nerves, and mucous membrane. The earliest sign of leprosy appear on the skin of the trunk and the extremities as small spot lesion colored differently from the surrounding skin. Types of leprosy. Various types of leprosies were identified. One is tuberculoid leprosy. Second one is lepromatous leprosy. Third one is borderline leprosy. And fourth one is intermediate leprosy. In tuberculoid leprosy, it's a superficial form, asymmetrical, shallow skin lesion containing very few bacilli. The lesion appears as thin granuloma and enlarged thermal nerves. It may damage to these nerves, usually resulting in the local loss of pain, reception, and feeling. This form has fewer complication and is more easily treated than other types of leprosy. No skin nodules formation occur. Occasional mutilation of extremities reactive to lepromin, lymph nodes not infiltrated by bacilli, and well-developed cell-mediated immune responses. Second one is lepromatous leprosy, responsible for the disfiguration of skin. It marked by chronicity and severe complication due to widespread dissemination of the bacteria. Leprosy bacilli grow primarily in cooler region of the body, such as nose, ears, eyebrow, chin, and testes. As growth proceeds, the face of the afflicted person develop fold and granulomatous thickening called lepromas. They are caused by massive intracellular overgrowth of Mycobacterium leprae, which causes a loss of sensitivity that predisposes the patient to the trauma and mutilation, secondary infection, blindness, and kidney or respiratory failure. It crosses skin nodules, mutilation of extremities, common. It's not reactive to lepromin. Lymph nodes massively infiltrated by bacilli. It's poorly developed by T cell responses. Third one is the borderline leprosy. Patient can progress in either direction along the scale depending upon the treatment and immunologic competence. Fourth one is the intermediate leprosy. Intermediate characters between tuberculosis and lepromatous leprosy. The severe effect of intermediate form of leprosy is early damage to nerves that controls the muscles of the hands and feet. The subsequent wasting of the muscle and loss of control produces drop foot and claw hands. Sensory nerve damage can lead to trauma and loss of fingers and toes. Based on the WHO classification, World Health Organization classification, intermediate leprosy, a few hypopigmented macules and heal spontaneously. In tuberculosis leprosy, a few hypopigmented macule loss pain, sensation and nerves become enlarged. In borderline tuberculosis leprosy, lesion like tuberculosis leprosy, numerous with less nerve enlargement. Mid-borderline leprosy, many reddish plaques and swollen lymph nodes. Borderline lepromatous leprosy resulting in many skin lesions with macules. Papules with a flat lesion, plaques and nodule formation. Lepromatous leprosy, early lesion and pale molecule, hair loss. Often patients have no eyebrows or eyelashes and limb weakness. Disfigurement of many areas including the face. The picture represents that lepromatous versus tuberculosis leprosy. Lepromatous early stage and late stage of the lepromatous leprosy. Lepromatous leprosy pre and post treatment. Next one is a transmission. Transmission occurs by person to person, spread through infected respiratory droplets. It can infect by entering breaks in the skin. It cannot infect intact skin. Clinical manifestation of a mycobacterium leprae is eye problems, muscle weakness, skin rash and skin stiffness. Skin lesions are lighter than your normal skin. Cooler lesions have decreased sensation to touch, heat or pain. Lesions do not heal after several weeks to months. Numbness or absent sensation in the hands, arms, feet and legs. Then diagnosis of leprosy. Leprosy is diagnosed by combination of symptomology, microscopic examination of lesion and patient history. Laboratory diagnosis relies upon the detection of acid-fast bacilli in smear of skin lesion, nasal discharges and tissue samples. Leprament is one of the important tests for identifying the leprosy bacilli. It determines type of leprosy. Injection of standardized extract of the inactivated bacilli intradermally in the forearms. Positive reaction 10 mm or more intubation after 48 hours or 5 mm or more nodule after 21 days. Negative reaction in lepromatous leprosy because of humoral mediated immunity, not cell mediated immunity occurs. Treatment in 1941, bromine introduced but painful injection. In 1950, Dapsone pills but resistant developed. In 1981, WHO recommends, World Health Organization recommends multi-drug treatment like Dapsone, Rifampicin and clofazimine. In tuberculosis leprosy, it can be managed with rifampicin and Dapsone for 6 months. Lepromatous leprosy, it requires a combination of rifampicin, Dapsone and clofazimine for 2 years. Intermediate leprosy, Dapsone can be taken alone for 10 years or more. WHO is currently sponsoring a trial of vaccine containing killed leprosy that show promise in clinical trials. I believe all of you understand the Mycobacterium leprae. Thank you all.